But that's why physicians reared up. Patients reared up because of all of the hassles. You weren't able to go to the physician of your choice. You weren't able to go to the hospital of your choice. You had to get approvals for simple and routine things. So it was all of the hassle that actually caused managed care to go from the HMO concept to the PPO concept to the open access models. And what happened when the HMO model disappeared? Healthcare costs started rising again. So there's no question that the model of healthcare has an impact on cost, but this comes back to the comment I made earlier that there are certain things that we like and we're willing to pay for in our healthcare, and that is choice and this freedom. So that's one aspect. Let me just make one other point about the issue of physician payment, and I very consciously stay on the secular side because I'm trying to create a counterpoint, but there's something very interesting. There's a Greek myth that goes back about 2,500 years, and it's the myth of Asclepius. Asclepius was supposed to have been the first Greek physician. Asclepius was actually killed by a thunderbolt because Asclepius received payment of gold for providing services. So there was a time where perhaps we physicians were not supposed to be paid for their services, but as you know, as we've gotten further from that point in time, for many of the reasons that were discussed, we in fact do see payment. Now that raises another important point, which comes back to the topic of today. With pressure on physicians, either because of downward pressure on reimbursement or I prefer pressure to improve their productivity and pressure to devote more time to their practices, what you have seen is a decrease in the willingness of physicians to volunteer their time for things such as teaching let me be concrete, in city hospitals and other teaching programs, which is where you see a significant concentration of uninsured. So these things have had, if not a direct impact, they've certainly had a very significant indirect impact, and that speaks directly to the issue we're focusing on today.
Any questions?
Pharmaceutical companies are not giving the samples to physicians that they used to, so they can't give the patients the kind of sample they used to give the patients. I mean, these are serious problems. You have people within the Orthodox community, Jewish community, not even conservative reform, that I've seen people that are dropping out of shuls, the synagogue memberships, etc., and they have to do so because they can't afford to pay for the medicine and to be a member of a shul. They're pulling back suffers, whatever it is. I mean, that's also a very serious problem.
Well, you know, the group that we didn't focus on is the insured individual with very limited resources, which is what you're talking about. The data on the Medicare population, Medicare itself being an interesting system to devote some time on, often are not able to comply with simple, obvious, good recommendations for care because they have to make the choice between, as you say, between the shul and medicine, between dinner and medicine. These are very difficult issues.
I guess those people who are dropping their synagogue membership in favor of buying a medication must not have heard Dr. Bernie Siegel talk a little bit earlier that says that attending synagogue might be as good as taking that medication. Yes, question over here.
Just wanted to add something to Dr. Jacobs. Just have another question also. I think we shouldn't forget that we're also living in an era of we are living in an era where physicians are practicing defense medicine right now, and that you're ordering a battery of tests that are not needed, and this is something that not practice in any place in the world, any other country.
Yeah.
And we just fear of maybe getting sued, and that has also influenced the cost of healthcare to rise. And unfortunately, the middle class is the one class to suffer
Yeah.
because the poor has Medicaid, they usually get out of the pocket,
Right.
and always in the country is based in such a way that the middle class always suffers, especially the ones that are not insured. And if I may, another question that...
Let me answer that one. I'm always amazed with people who stand up at a microphone and take 3 or 4 questions and stand and remember all of them. I'm very good at remembering one at a time. The question had to do with the issue of defensive medicine and the malpractice issue. I guess we could have merged a couple of rooms. There's a malpractice session underway right now. I'm sure both Rabbi Weiss and I, we both had the challenge of, well, what information do you lay out to stimulate a discussion? The issue of just the basic issue of cost escalation in healthcare is such an incredibly complex one, and one of the issues certainly is defensive medicine. That is, physicians who do things not because the patient needs it, but because of fear that if they don't do it, the likelihood of them being sued for something down the line increases. So there's no question for this poor patient who comes in with no insurance that there may be many dollars worth of testing or procedures that are done really to doctor the record more than the patient. And that's one of many, many different issues. Very, very complicated and clearly interfaces with what we're talking about. No question.
Okay, thank you for that. And also, I have another question. Canada is having like national universal healthcare plan where everyone has medical insurance.
Yeah.
What's the problem with this country that cannot follow Canada and provide universal insurance?
Yeah, that's a very good question. The question was, well, for goodness sakes, Canada and numerous other Western European nations have universal health coverage, and why can't we simply do it? And I think there are really a number of answers to this. The first is what I was getting at in my comments, and that is our system is so tightly embedded into our business framework, our tax structure, our own American psyche, if you will, that it's very, very difficult to unravel it. Go back a dozen years to Hillary Clinton's initial attempt at healthcare reform. We agree it's needed. We absolutely do. We even agree on many of the elements, but not on my nickel. I mean, that's part of the problem. So that's half the story. The other half of the story is that the other systems, whether it's the British system or the French system or the Canadian system or any of the other socialized systems, all have similar problems. There is no national system of health care that is proceeding comfortably, addressing issues of very significant health care inflation, that has both a patient base and a provider base that is comfortable with the interaction. So we're all struggling with the same things in a very different context. Now, it is true that in many of these other systems, we would not be sitting here talking about the uninsured, which quite frankly is a very significant blemish on the American system. There's no question about it. But I don't think that we're dealing with the wonderful system on the one hand and the horrible things we do. The uninsured stand out for us, no question, but the problems are really otherwise not very different.
I think just to highlight the problem so that